We don't really know what causes high blood pressure. We do know risk factors that lead to high blood pressure in individuals. Some of those common risk factors can be family. Sometimes it just runs in the family, and you have multiple generations with high blood pressure. Another thing can be overweight. We know that being overweight can cause high blood pressure. Being inactive can definitely affect your blood pressure. Other things are tobacco and alcohol. Those things can affect your blood pressure as well. So normal range for blood pressure depends on the age. We don't think about high blood pressure in children, but as we have more obesity in the United States, we do have more children that will have high blood pressure. And actually, in children, less than 120/80 can actually be abnormal for them. But for adults, less than 120/80 is a normal blood pressure. If you're over the age of 50, we don't treat until your blood pressure gets a little bit higher, 150/90. The main things that you can do to lower your blood pressure are not actually medicines. I have many people that come in and ask me, Dr. Starbuck, what can I do to lower my blood pressure? How many medications are you going to give me that I'm going to have to take? I'm like, well, actually, there's 3 or 4 things that we want to consider before we even think about medication. Weight. If you can lose 5% of your weight, if you're overweight, that can decrease your blood pressure by 10 points. Exercise is something that we all can do. You don't need any equipment or anything for that. Walking, moderate intensity walking for 30 minutes can lower your blood pressure equal to at least 1 or 2 medications for 36 to 48 hours after you exercise. That's better than medicine. Medicine usually lasts for 12 or 24 hours. Yes, I recommend that my patients take their blood pressure at home. Studies have shown that blood pressure taken at home in a certain way, in a standard way, is actually sometimes as good, if not better, than blood pressure taken in the office.